Oh! This is in a video game? Fiery arrows, Viking wrestling moves, and big ol' pointy things you should avoid. Today, we're headed back in time to the British Isles, breaking down and reacting to all of the unpleasant medical scenes and colorful injuries from Assassin's Creed Valhalla. Let's dive right in. Oh! Huge punch to the face right at the beginning, and you just see blood splatter everywhere. I mean, blood will splatter, but not like that. Lands on his head. Could you potentially have a cervical fracture? Maybe. It has to do with a hyperflexion injury. Typically, when we see fractures relating to that type of injury, it's because of either the vertebral bodies smashing on top of each other, or you have a ligament that's attached so tight that it pulls off of the bone. Oh, look at that elbow. A nasty dislocation, maybe fracture, hard to know, obviously, in that moment. That's gotta hurt. That's gotta hurt. You have your nerves that are running straight through that area. Typically, most fractures of the elbow either occur on the olecranon process, which is the big elbow bone. Very rarely is it the radial head. Oh, slow-mo. Cool blade injury right underneath the mandible to the soft tissue going straight up. That type of injury could be just soft tissue, could cause some fractures in the front part of your face, but if it's missing your brain, it's more just nasty injury to the face versus anything deeper. Whoa, decapitation, being that strong to be able to do that, hard to know if that's actually possible. I don't see these injuries. They don't come to the emergency department. Obviously, if you're decapitated, you're not going to live. Oh, does it cause that type of injury? Does it stick inside? Most of the time, it's probably going to bounce right off. Injuries that we see that people get to their face are usually blunt from using your fists or kicking or knees. And then obviously mechanical falls where people fall on their face. Some car accidents, obviously. Those are the big ones that we see in the emergency department. We do see a lot of crush injuries and fractures to the skull. Fractures to the skull typically will heal on their own. You don't obviously like put somebody in a cast on their head unless there's a massive deformity, but even then, do you use a plate to help support it? Okay, using a hatchet.
You know what a hatchet is, don't you, Bug?
Because the fulcrum is short, the strength of the individual actually plays a bigger component than the weapon itself, because you have to be able to swing it hard enough and fast enough to be able to penetrate through a skull. Whoa, whoa, choking him out. Okay, I saw blood pop out. I don't know what that was. You can cause somebody to choke for multiple different reasons, pushing on the airway itself, collapsing the vessels of the neck, and that somebody could actually die, and typically due to the fact of lack of oxygen and lack of blood flow to the brain. Whoa! Stab wound to the lower abdomen and inner aspect of the left leg. If you get it into the right place and deep enough, you might be able to hit the femoral vein, femoral artery, but they're pretty protected. They're deep in there, and that's the way our bodies are made. They're actually more superficial in the groin and like right behind the knee. Low in the abdomen and the pelvis area, you're worried about the bladder, you're worried about your intestines. Those are pretty much the main structures there in the midline. Oh! This is in a video game? Stabbing to the lateral aspect of the neck, left side. You have your sternocleidomastoid muscle, your platysmus muscle, and you have some scalene muscles that also are on that side. All have to do with protection of the neck, rotation of the neck, all these different aspects of movement, but they're also protecting vital structures. Okay. I don't think normal people will be walking around with a weapon that large. You have to use your full body to wield that. Using that momentum and the weight of the object is what's probably causing the amputations to occur. It looked like it was a below-the-knee amputation, which actually occurs at the hospital if somebody has horrible peripheral vascular disease, or if there's significant trauma to a lower extremity and you can't save it. Oh man, a huge axe just getting stuck in the upper back, probably hitting right into the spine. The spine and the spinal cord in the back is actually deeper than you think. When we have to do a spinal tap, we're using a needle that's like 3.5 inches long, and we're getting most of that bad boy in there. Usually we do go in at an angle, we're not going directly in, but it gets far in there because you have just multiple different layers of tissue. That axe is so big. Obviously, that's not realistic. But we do see people that get penetrating traumas to their head, either by bullet, very unlikely a knife. A lot of times I've seen nails. Just depends on the area of the brain that it hits, but you're always worried about swelling as well as bleeding in the brain. Oh! Whoa, big sword straight through the chest cavity. If it goes through the heart, obviously done for. Maybe you won't bleed out very quickly, but even if you try to take it out slowly and you got a medieval doctor there around, probably not going to be able to be survivable. And then if it misses to the right, you're still hitting the lung itself, and that could be a big cavity, big hole in that area. Oh, clavicle fracture, possibly. If you got a lot of muscles there, of your trapezius muscle, it can protect you. And then you're always worried about the upper airway. But underneath the clavicle here, you have your subclavian vein. That's major blood vessels in that area. Sometimes if somebody needs a central line, we'll actually stick a needle right where it kind of curves in. Oh, a hammer. Oh my gosh.
Pick up the hammer.
Just causing significant amount of blood trauma. The biggest thing we worry about after fractures, dislocations, are you going into like rhabdomyolysis, which is muscle breakdown, which then could lead into kidney failure. Or the other component is so much trauma to an extremity, do you increase the risk of having compartment syndrome, which if that occurs, you need to fillet the tissue open because the compartment syndrome causes compression down on the blood vessels, not allowing blood flow to go through. Oh! Crushing the neck itself. It's cartilage here, right? It's not bone. You have a hyoid bone that sits above here, but all this is cartilage. It takes a lot of force to fracture cartilage because cartilage actually gives, right? It's soft, it's movable, you know, and these don't go all the way around. They're not like a distinct ring. There's only one that goes all the way around, and that's your cricoid. Head trauma. People hit other people with their own head. Here, there's a pretty thick part of your bone.
Pretty thick.
Even if you hit somebody, you can actually cause a concussion to yourself. Your brain sloshes back and forth, and you can cause a contusion to your brain. You can have post-concussive syndrome where you have dizziness, lightheadedness, visual changes, nausea, vomiting that can be prolonged for, you know, weeks to months, even a year, and headaches as well. Oh, you gonna burn them? Oh my gosh. The individual is wearing fur. If it's super dry, it looks like you put some alcohol on to burn. The things you worry about burn injuries are, one, the soft tissue issues. Fire requires oxygen, so potentially it's taking away the oxygen surrounding you. And then are you inhaling those hot flames, which then can burn the mucous membranes? This was actually really cool. The way that they portrayed the graphics and the injuries, very interesting, and allowed, again, me to discuss what I see on a daily basis in the emergency department. Let me know what your favorite Assassin's Creed is. If you guys enjoyed this, definitely check out this playlist right here. And as always, do me that huge favor. Make sure you subscribe, hit that like button, and turn the bell notifications on. Thank you so much for watching, and stay healthy, my friends.